Please.
Pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
That's. Nice. That one over there too. Okay. Okay, at this time, is there a motion to adopt the agenda for today?
So moved.
A second.
Any questions on the agenda? If not, roll call please.
Mrs. Salapata?
Yes.
Mr. Barry?
Yes.
Mr. Adavazio?
Yes.
Mr. Dubus?
Yes.
Mr. Simon?
Yes.
Mr. Messersmith?
Yes. Sorry. Is there approval of May 22nd meeting? Are there any additions or corrections to it? If not, is there a motion to accept the minutes as presented?
Someone. Second.
Second by Mr. Simons. No questions, roll call please.
Mr. Barry?
Yes.
Mr. Simon? Mr. Adavazio?
Yes.
Mr. Dubus?
Yes.
Mrs. Salapata?
Yes.
Mr. Messersmith?
Yes. The Health Commission report is next.
Thank you, Mr. Chairman. You have my written report, but I have several additions that I want to raise awareness to the board. The first is on June the 13th, the US EPA issued a notice of violation to 3 charter schools, one of which is within our jurisdiction. That's the Niles Preparatory Academy, over concerns of lead-based paint exposure as well as asbestos hazards, and ordered the schools to vacate until matters are addressed. So we did send one of our inspectors out to verify that the school that is in our jurisdiction is closed. It currently is, and we're working with the Ohio Department of Health to arrange for any testing of any child with parent that wants their child tested that was attending the school, and again, ODH is working with the US EPA, so it's all a coordinated effort. And in case you may have heard the press release a few weeks ago, and I just wanted everyone to be aware that we are working with the state and federal officials to provide any testing for any families that want it. Second thing is the Ohio Department of Health issued a alert for assistance for healthcare providers to strengthen summer surveillance for influenza, especially as the county fairs are going to begin, and there could be contact with livestock. The concern is to identify any novel strains of influenza that might be transmitted. As you heard me previously report of some novel strain of influenza crossing from cattle over to some of the farmers. That has happened, like I said, in recent months. So that's the concern, that they want to just keep an eye as there's going to be that type of interaction. Third thing that I want to go over is earlier today, I spoke to Josh Thomas with Baker Bednar Snyder, and he stated that they should be pretty much finished with their assessment, have something drafted by a week, in about a week or so. And they'll be ready to meet with the board, go over the report, answer any questions. So I just wanted to let the board know when that comes about. I don't know that we should wait until the middle of August when our next meeting would be. I plan on requesting to have a special board meeting for the purpose of going over that report, and like I said, then they can let us know what we're looking at with the two roofs, and if we need that, if we actually need to go through with getting estimates, then, you know, they can draft that. I also would tell you that, with that, I think that a special meeting would be important, not just to get that, but I think that we may need to expand the scope of what they do for us. As we had, someone looking at some of the front fascia of those sandstones that are, you know, on the wall there. And just to make sure that there's not an issue, because we are actually seeing a hole now. And one of them is to make sure that we don't, that it's gonna be stable, making it through the winter without those things falling off the wall out there and creating a hazard, so. You know, just basically letting us know our options for that as well. So, like I said, I'll let you know when I hear more about that. And we get that special meeting. Obviously, John will be reaching out to you to schedule that. The next thing is that the Centers for Disease Control issued a health advisory. This went out yesterday, again, to raise awareness of the increase in dengue viral infections in portions of the United States. Dengue virus is a result of the bite from an infected mosquito and is a concern to travelers in areas where the incidence of disease has increased. So we are being asked to raise the awareness, especially to healthcare providers, as well as to promote mosquito bite prevention measures, which we already do. We have that, we've been successful in obtaining that grant each year. We have a number of advertisements that we're doing, surveillance of our own that we're conducting. So we are, you know, getting that message out there, but it's important to understand that people are going to travel this year. They're going to go down south, and that's where they're seeing some of these higher rates of infection. And so I know our epidemiologist is getting that word out to our healthcare providers to look for some of these symptoms, ask the questions if they've recently traveled to one of these high risk areas, and then you know, we could share that information with the state then. And then the last thing that I wanted to go over is that, as you know, our staff has endured quite a bit of additional duties over the last 6 to 8 months. And with our move and shifting our duties to some of the new grants now and programs, our staff has graciously stepped up to the plate and not complained and put in extra effort. We have also been asked to participate in really an unusual amount of health fairs, a lot more than we've ever had to participate in the past. And once again, our staff has answered that, participated in them, and we're not, you know, they're basically flexing their work week to make this happen. So they've really been remarkable of all that they've been put through and asked of, and really came through for us. And then the other thing too is the planning that we've done for the county fair that's coming up here in a few weeks. As you could see, the packet that was put together, I mean, one of our food service inspectors took the lead into holding regular meetings and really planning for a successful what we're going to be doing at the fair at our booth. It's quite a bit. So for all those reasons, and again, the many times that our staff has went above and beyond their normal work duties, I'm requesting that our board recognize and reward their efforts by giving the entire staff off July the 5th of this year, extending the holiday through the weekend. So I'd like that in the form of a motion.
I would move on that.
There's a second. Any questions or discussions on the motion?
Yeah, I do.
Right.
Frank, what would this cost the district, the taxpayers of the district? How much would this cost paying all these wages?
The 1 day's wage?
Yeah.
I don't know. Do you know what that 1 day
No,
wage?
no.
a ballpark figure, like 8 or 9 or 10 or $1,000, or we have?
50,000 or less probably.
It's not really an additional cost because we'd be paying the wages if they were working. Anyway, we're not paying them overtime, we're just paying the regular wages for that day, correct?
Correct.
So it's not, it's a fee that.
But it's a regular scheduled work day. I mean, it wasn't
Yeah.
a contractual thing or anything, right? I was just trying to be
Yeah.
fiscally responsible to the, to the taxpayers of the district. And I do think our staff does do a really good job. It's nothing to do with that.
Any other discussions on the motion?
I have a question. Was that ever negotiated in the contract? It's the, there's more than one holiday. It comes on a Thursday or Monday or something.
Yeah, well,
Did we ever negotiate that in?
no,
there?
that's not
Did it
been
get
something.
done? No? Okay.
The 4th of July is kind of a major one, more so than the Groundhog Day.
Usually what they do, Bob, is they will shift those days closer to Friday or Monday, minus Christmas.
Well, I know they,
4th of July.
they're pretty good at it. Everybody's good for us at contract time, and it makes it a little easier, and if the thank you is showing we're grateful, we should do it.
Any other questions or comments before a roll call? If none, roll call, please.
Sorry. Mr. Barry,
Yes.
Mr. Adavasio.
Yes.
Mrs. Salapatta,
Yes.
Mr. Dubus,
No,
Mr. Simon.
No.
Mr. Messersmith.
Yeah. Is there anything else, guys?
Yeah.
We
it's
haven't
not
brought them
Mr.
in.
Messersmith.
Once we get down to the frame.
That's everything I have.
Okay, I have a question. On that first one with the schools, that are closed, are they planning on having them clean before the school year starts, or what's the long-term program? I mean, basically, if the government's involved, like that lady in East Palestine now said they shouldn't have let the trains catch on fire, but where was she then?
Yeah, so, US EPA is overseeing this effort, and so one of the things in their notice of violation that they sent to the schools was increasing some of the, testing of the buildings to really understand the extent of where there's lead-based paints, as well as any of the asbestos and the form that it's in, and the risk that it poses to both, not just students, but employees as well.
But that testing won't be done before school starts, so where are they gonna hold school this year?
Yeah, they'll have to come up with an alternate means if they don't, promptly get this testing in and ensure that there's a safe environment there.
If I read the article, if I remember correctly, I don't know about the lead, I thought it was in the pipes, I didn't think it was lead paint. And I thought it was lead pipes for the drinking water, but the asbestos, but I may be wrong there. The asbestos, if I understood it correctly, they needed a management plan in place. But that meaning that the building has asbestos in it, they're not gonna remove it. They put a plan in place, you write a plan that says this room will be isolated from the rest of the school, will be maintained, and the custodial staff have to be educated every year, like for 4 hours on how to handle it. That's something that could be done before school starts, but maybe I'm wrong.
No, you're absolutely correct on the asbestos component. They have to have a management plan, and they didn't submit one on time, or they don't have one of the two.
That's not.
But my understanding in the report that I read, the actual report, was that there were some areas of concern of lead-based paint.
It was paint.
Yeah.
That can be either encapsulated or removed.
Right.
And to add to that too, it's my understanding is they were looking at the one in Youngstown and the same owner owned all three, because I had two inspectors that said that there wasn't really any construction going on in the one in Niles right now anyway, so I think they're trying to get all three schools back in line. So.
Any questions for the, on the
I do
request?
have one more thing for Frank. These two flags, I've seen them somewhere. What's the story on them?
Well, you can, thank the medical director, because he, had those made for this health department to be in this room and paid for those to be here. So, yeah, I think it was a real nice gesture by Dr. Henry to do that, and they look great.
Thanks, Doc.
Thank
you.
They're made from a retired fire hose,
Yeah, that's,
and one of the youngstown firemen makes them. And I don't know, it seemed like appropriate for the new building, and I asked them to make an emblem.
yeah, that is.
So Frank and John have provided that. And anywho, I hope that everybody likes them.
Very
Yeah,
nice.
very nice. Thank you.
Any other questions or comments? If not, at this time, I'd like to have a motion to have Dr. Forster join the meeting. Second by Kathy.
Yeah.
Roll call, please.
Mr. Excuse me, Mr. Simon.
Yeah.
Mrs. Salapata,
Yes.
Mr. Adavasio.
Yes.
Mr. Dubus.
Yes.
Mr. Barry,
Yes.
Mr. Messerschmidt.
Welcome, Dr. Forster. Well, thank you. You're now entitled to all the privileges and so forth that goes with it.
Okay, I still need a motion to accept Frank's report.
Okay, yes, there's a motion to accept the report, like. Second, Mr. Barry,
Yeah.
if there's any other questions or comments for the help for the report. If none, roll call.
Mrs. Salapata,
Yes.
Mr. Barry,
Yes.
Mr. Adavasio.
Yes.
Mr. Dubus.
Yes.
Mr. Simon.
Yeah.
Dr. Forster, sorry. Mr. Messerschmidt.
Yes. One comment, Mr. Dubus, about the wages for the employees. Notice that we're saving money by state, not any paper clips on the papers anymore. So there's a savings there that'll add up in the long run.
Yeah, but we just increased our cost for our emailing system last month for by $9,000 a year that we never had to pay anything for before. So I was just trying to be a little bit
I understand what you're saying.
watching the money.
Right. I respect you for that. But, I mean, that could lead to other holidays before or after Groundhog Day. That's negotiated holiday yet. Okay, Director of Nursing, you have a report from her. Does anybody have a comment on that report? You've read it? If you have any questions, write it on and we'll bring them up next meeting. Is there a motion to accept the Director of Nursing report as presented?
So moved.
Second,
I'll second.
there's no questions, roll call please.
Mr. Dubus.
Yes.
Mrs. Salapata,
Yes.
Mr. Barry,
Yes.
Dr. Forster,
Yes.
Mr. Adavasio,
Yes.
Mr. Simon, Mr. Messerschmidt.
Okay. Director of Environmental Health report.
Thank you, Mr. Chairman. So I provided a written report. I will add, I was gonna bring up in my report about the fair. So we got the fair, well, coming up pretty quickly, 2 weeks. So we'll all be out there if you guys want to come out and see us, but, basically reiterating what Frank was doing. You know, Jody took the lead. We're actually combined with the EMA. Officially this year, so Pete Hickey will be in our tent and he's, you know, helping out with some of the costs and so forth. We're gonna do some different things this year, some giveaways. They're gonna have, I believe, but one of the things they're gonna try to have is like a dummy, and maybe if somebody wants to inquire about CPR or just gonna try to do some education on a daily basis. Nothing set forth on what day will be what. We're just kind of doing a test run here to see as much education as we can get out and talk to the public a little bit more about what they want to talk about in that sewage. So we're trying to, you know, get the message out that there's other parts of this organization than just environmental. The second thing is we did participate in the Cortland Street Fair. We had Aaron led that, and there was a number of volunteers that came out. John and Dan and Jen are sitting here, and there was a few others too. Myself, we had a table out in the Cortland Street Fair, again, passing out information. You know, answering questions the public have. And then I believe John and Dan and a few others came on Saturday and we're in the parade. So they took the county truck and they were in the parade and threw out candy for the kids and so forth. So all reports was it was a good thing, and we're trying to ingratiate ourselves into Cortland City, so it was nice to be even invited. But I wasn't sure how many, and that happened pretty fast because it wasn't a whole lot of time to let people know. It was like a couple of days and we jumped into it, so. I just want to at least let the board know that we did do some public outreach there before we for the street fair done. And again, it was all volunteer time on staff's time. So, but that's all I have. If you guys have any questions, I can answer those.
Are there any questions? Any questions on the report that you presented with?
Yeah, I just like to comment that I've noticed the C&D construction demolition debris landfills. I've seen in the last several reports, you've stepped up the inspections much more than that we're required to do. And I like to say that I appreciate that.
Yeah,
To see that.
my pleasure. Yeah.
Any other questions or comments? If not, there's a motion to accept the report that's presented.
So moved.
Second.
Second.
Mr. Young, seconded it. If there's no other questions, roll call please.
Mr. Dubus?
Yes.
Mr. Adavasio?
Yes.
Mrs. Salapata?
Yes.
Mr. Barry?
Yes.
Dr. Firster? Mr. Simon? Mr. Messersmith?
Yes. Okay, in the back row or the front row, whichever you want to call it, the grants coordinator report.
Yes, thank you, Mr. Chairman. I provided a written report. I would like to point out on COVID-19 enhanced operations EO 23, that first page, that third grant listed down. I told you last month that we applied for additional funding to help cover some of the renovation costs that went over and some expenses. We did get that approved by the budget. That date is wrong. It's now going to December 31st, 2025. So with this additional funding, some costs that went over are covered. We're gonna be able to cover some of the new projects like the offices that we've already done. And additionally, in there, since our email got added, it's more expensive now, we're covering that for at least a year. We're gonna get some other software in our GIS and Tableau for our epidemiologists to help create better data to help us get more grants, and then as well as staff time too. So there's a lot of things that are gonna be coming out of that grant that'll help give us some time of it until end of 2025.
Do you have any idea how much the additional money was? Is what?
250,000?
235.
235, yeah, around there was the additional that we got approved.
Good.
And let me know if you have any other questions.
Are there any questions? I was told that the one grant is being terminated.
Oh, yes, Moms Quit for Two is a tobacco cessation program for pregnant women. It was supposed to go into a third year, which would be starting here July 1st. We had some trouble getting participants to enroll and stay enrolled. And they did change it in the middle of the second year. It used to be they had to be enrolled for a whole year. Now it's only 6 months. And us and a few other counties weren't reaching those numbers. So we were struggling. We're going to struggle to continue on the year 3. And we were going to be done with it after that. So ODH has asked us to stop now. So anyone who is in the program has either completed, they will be coming tomorrow to finish up their visit, or if they are still in it, they will be enrolled in telehealth with baby and meat tobacco free. So the services will still be offered to any of our residents, even with that.
That's the grant on the second page, the third one down possibly,
Yes,
the 21,000.
yes.
We're losing something that's not, we won't have to dim the lights too much to.
Yeah, it wasn't a huge grant, and with some of these new programs that Frank mentioned, and with hiring the 2 new health educators, like I said, we were just gonna get through this last year anyway, and our plans were already to move staff time around and accommodate for that, and we're just kind of speeding that up. It'll work out.
Is there a motion to accept the report as presented?
So motion.
Second, are there any questions, additional questions? If not, roll call please.
Mr. Adavasio?
Yes.
Mrs. Salapata?
Yes.
Mr. Dubus?
Yes.
Mr. Barry,
Yes.
Dr. Firster, Mr. Simon.
Yes.
Mr. Messerschmidt.
Yes. The next one is the accreditation coordinator.
Thank you, Mr. Chairman. I've prepared a written report for the board, and I'll take any questions if you guys have.
Anything on there that we should be particularly focused on or not?
No, as I stated earlier, a lot of right now is just accumulating all the documentation and putting it in particular order. Fab has very rigid standards on how we compile the documentation and submit it to them, because their site visitors want to find everything. They actually use the term "make it obvious" for the site visit. So for that reason, a lot of time is being dedicated to make sure these domains are compiled and archived properly. So when we do submit, the site visitor should not have any issue seeing what we have and us being able to fully demonstrate.
They have given you guidelines of how it should be assembled.
Yes, very strict guidelines on how it should be assembled. For instance, if we're using our community health assessment, which is roughly 100 pages long, but I'm only using page 57 of that community health assessment to demonstrate something for them. When I compile that within the PDF that I submit to them, the PDF number must be the PDF from what I give to them, rather than the page number from the shop, from the community health assessment. So if you can imagine, as I pull documents to fulfill these standards and measures, I'm pulling from several different sources and creating a whole new document in and of itself. So Frank, the first domain was what, roughly 200 pages long. This second domain is larger than that, and we have 10 domains, so
You have job security then.
thank you. So, I mean, if you were looking for a rough estimate at all, 2,000 pages or more when all is said.
That's just something. So there you go, great. Wasted paper.
Yeah.
Yeah, along those lines, and much like talking about being fiscally responsible, at one of the most recent reaccreditation meetings that we had, Jenna suggested, and I think we're gonna go with it, when we do submit a PDF off those papers, but when the site visitors do the virtual site visit, I think we're gonna actually use an electronic format. So when they do ask us a particular question about a measure, we can perform a search with our, our computers or our iPads or whatever we're using while we're having those site visits, as opposed to rifling through 200 pages of a particular domain. So we are gonna move in that direction.
You don't have to sleep in the cave anymore. Any questions? Not, is there motion to accept the report presented? Very, seconded by Mr. Simons. No further questions? Roll call, please.
Mr. Barry,
Yes.
Mr. Simon.
Yeah.
Mr. Adavasio,
Yes.
Mr. Dubus.
Yes.
Mrs. Salapata,
Yes.
Dr. Firster,
Yes.
Mr. Messerschmidt.
Yes. The health educator report you have in front of you. If you have any questions, write them on the back.
He had a meeting. He's not on the call.
I was gonna say, I thought he said he was gonna try
He's
to.
gonna try, but his meeting must have gone over.
Okay. You have to get off. Does anybody really have any questions on that report? Seriously. If not, there's a motion to accept the report that's presented to us.
So moved.
I'll second that.
Oh, did Kathy make that? Oh, I'm sorry, I didn't hear. Your hand go up. There's no further questions. Roll call, please.
Mrs. Salapata,
Yes.
Mr. Dubus.
Yes.
Mr. Adavasio.
Yes.
Mr. Barry,
Yes.
Dr. Firster,
Yes.
Mr. Simon.
Yeah.
Mr. Messerschmidt.
Is there a board report from anybody? If not, is there any old business? If there's no old business, moving into new business. Starting in with unfits. The first one is 1358 Gilbert, Weathersfield Township, Larry P. Kirby.
Okay, so that's me, Mr. Chairman. Give me
Okay,
a second.
wait, we won't go that fast, we'll let you catch up. We got it still in the backyard. Well, it looks like it. Move in condition, you can just move right in.
Okay, 1358 Gilbert, okay, so this one comes to us from Weatherfield Township zoning. Missing roof. Exterior finishes, roof is damaged, which causes mold, missing valley ceiling damage, excessive damage, insulation. Present solid waste, no electrical components, missing plumbing components. Basically, the roof is bad as there's mold issue for sure.
It's amazing how it happens overnight and you'll see it. I mean, it might have been going on for the last period of time.
But now,
Could have.
but I'd ask the board to adopt the motion as presented.
Is there a motion to that effect? So motion. Second. Roll call, please.
Mr. Adavazio,
Yes.
Mr. Simon,
Yeah.
Mr. Dubus.
Yes.
Mrs. Salapata,
Yes.
Mr. Barry,
Yes.
Dr. Firster,
Yes.
Mr. Messersmith.
The next one is 297924 Hubbard Bedford Road, Hubbard Township. Judith Morrison and Lori Horvath owners, are they present?
Sorry, there was a lot of pictures of that last time.
Dan,
And I believe,
is that them?
we believe they're on the call.
That's it, okay.
Okay, so this one comes to us from Hubbard, zoning, missing roof. Tree through, present solid waste, gross unsanitary condition, no electrical components. I'd ask the board to adopt the motion as presented, and do they want to say anything online?
You online, you chance to speak?
Yes, please.
Okay, go ahead.
These were our father's properties and he passed away 3 years ago, and we just finished with probate actually through the winter. And we were trying to decide if these should be torn down. Obviously, 2 of them need torn down, but what we're going to do with the center property is really kind of where we were.
Okay, so let me give you a little background on what our role is here. So the townships ask us to do inspections and see if these structures are livable or fit for human. It doesn't sound like you would argue that they're not. They are, it seems they are unfit for human habitation. The board's role is to simply make that declaration, and then it goes back to the township to do something with it. So I
We
would
don't do
advise,
something with it on our own.
yeah, I would advise you to talk to the township. So once the declaration is made,
Okay,
we don't have any more role in it at this time. The township will be back driving the bus, so to speak.
okay, they never contacted us about anything.
Oh, really?
No, your paper was the first paper I received in the mail.
Oh. Well, I don't know why that is, but you might want to call Steve at zoning, for the next, 3 properties and then
Okay.
see what Hubbard expects of you.
Gotcha.
That make sense?
Yes,
The owner?
So you guys are the owners now because it just got through probate, correct?
yes, probate just finished through the winter.
So they're the owners,
Of
Jude.
the next 3 properties.
Of the next 3 property.
2 more.
Yes, they're in a row.
What was your dad's name?
Charles Shear.
But anyway, so yeah, does that make sense what I said? I talked a lot in the past.
Yeah,
so-
no, it makes perfect sense. Yes, I understand.
Okay, so your next step is to talk to Hubbard and see what their expectations are.
Is
Okay.
there a motion to effect to declare this property unfit?
So moved.
Seconded by Mr. Barry. Roll call, please.
Mrs. Salapata,
Yes.
Mr. Barry,
Yes.
Dr. Firster,
Yes.
Mr. Dubus,
Yes.
Mr. Adavazio.
Yes.
Mr. Simon, Mr. Messersmith.
Yes. Next one is 7896 Hubbard Bedford Road, owned by the same people.
Right, so again, comes from Hubbard's zoning, missing badly ceiling tiles, mold or moisture, present solid waste, gross unsanitary conditions. There's no, there's the structures in horrible condition. So I'd ask the board to adopt the motion as presented.
Is there a motion to that effect? So moved. Seconded by
I'll second.
Kathy. Roll call, please.
Mr. Simon.
Yes.
Mrs. Salapata.
Yes.
Mr. Barry,
Yes.
Dr. Firster,
Yes.
Mr. Adavazio.
Yes.
Mr. Dubus.
Yes.
Mr. Messersmith.
Yes. That was See, from which house number?
79.
7916.
The next one, 78, 79, 60.
Okay, that's what I have in my hand. There's the pictures.
So this one, again, Hubbard zoning sent this to us, present solid waste, gross unsanitary conditions. No electrical components. I'd ask the, board to adopt the motion as presented.
The owners, you're not sure what you're gonna do with this property? Is this the one you had a question about?
Are you
Yes,
guys on me?
I'm sorry, yes, this is the one that, my sister was going to attempt to potentially redo.
And that's an option for you. You just have to let Hubbard know that and
Okay.
see how they want you to do it, what kind of time frame and so forth, because once you do, if you do renovate it, you can approach them, and if they're okay, they will then approach us to do a rescission for the unfit.
Okay,
So if you get it to the point where Hubbard is happy with it, they'll then approach us and say, okay, can you guys undo the unfit? so to
gotcha.
speak. Okay,
Now, is it up to the Hubbard zoning commission? Do they do anything with taking the structures down, or is that all on us?
well, I'm not a lawyer, so I won't give any kind of legal advice, but my understanding is the township has certain abilities they can do. I don't know if they would do it and then put it on the taxes. I don't know if they would work with you to get it down. I don't know if there's grant money available.
Okay,
So I don't exactly have the answer for you on that.
okay. Thank
Anything
you.
wrong?
Is there a motion to effect to declare this property unfit? 7916.
So moved.
Roll call, please.
Mr. Dubus?
Yes.
Mr. Simon?
Yeah.
Mr. Adabazio?
Yes.
Mrs. Salapata?
Yes.
Mr. Barry?
Yes.
Dr. Firster?
Yes.
Mr. Messersmith?
Yes, it's on the same road again, but different owner. 7620 Hubbard Bedford Road, Jason Adamson owner.
Okay, so this one, again, Hubbard zoning, Hubbard Township zoning, sent this to us, present solid waste, gross unsanitary condition, no electrical components. I'd ask the board to adopt the motion as presented. I don't know if anybody's online for this one.
Is Mr. Adamson available? If not,
There's something with the chat. Did somebody
No,
send
that
that?
was one Dan sent earlier, guys, let everyone know what time it starts.
is there a motion to that effect? What made and second? Jack made the motion, Lou seconded. Roll call.
Mr. Simon?
Yeah.
Mr. Adabazio?
Yes.
Mr. Dubus?
Yes.
Mrs. Salapata?
Yes.
Mr. Barry?
Yes.
Dr. Firster?
Yes.
Mr. Messersmith?
Yes. The next is also from Hubbard, 7547 Chestnut Ridge Road, Michael.
Baroda?
Yeah. Yes.
So this one, present solid waste, mold and moisture, rodent and insect infestation, gross unsanitary conditions. So I'd ask the board to adopt the motion as presented.
Was there an outside picture? The house
Yeah, the first one.
was the first
Yeah.
one? Yeah, I was blinking, I didn't see it.
All right, we tried a new thing.
There it is. Oh, there it is. Is Mr.
I'm trying.
Corolla available? If not, is there a motion to that effect?
Yes.
So motion.
Alvazio made the motion, seconded by Mr. Dubus.
I'll second.
Roll call, please.
Mr. Adabazio?
Yes.
Mr. Dubus?
Yes.
Mrs. Salapata?
Yes.
Mr. Barry?
Yes.
Dr. Firster?
Yes.
Mr. Simon?
Yes.
Mr. Messersmith?
Yes, another one from Howard. 1944 Wick Campbell Road. Karen Heaps, is Karen Heaps here?
Okay, presence of solid waste, gross unsanitary conditions, no electrical again, structures in full collapse. I'd ask the board to adopt the motion as presented.
Is there a motion to that effect on this property?
So moved.
Brick house. Jack made the motion, seconded by Mr. Barry.
No, wait a minute. I thought,
Yeah.
I thought Mrs. Salapata did, so now tell me who, what are we doing?
I thought must have been overlooked, Mrs. Alfetta.
Okay,
It's on Mr. Barry. We will give her credit.
okay, so Mr. Simon made the motion,
Yes,
okay.
she needs to build up credit because she has to get that training class in this. Roll call, please.
Mr. Simon, Mrs. Salapata.
Yes.
Mr. Barry,
Yes.
Dr. Furster,
Yes.
Mr. Adavazio.
Yes.
Mr. Dubus.
Yes.
Mr. Messersmith.
Before we go to the next one, Mr. Chris, the Hubbard zoning, he wanted our back records for 10 years. And now he isn't even being current on what he's telling his clients. And that kind of like, he did have a records request for what, 10 years ago?
Yeah, we only keep things on record for 5 digitally.
But he never notified these people supposedly. So one hand doesn't know what the other hand's doing, he got them both in his pocket.
But it's possible that he could have notified the owner record,
Instead,
which, yeah, but he would have sent him, you know, the notices to them.
well, we gotta blame the funeral home man if they didn't forward it. Okay, the next one.
Okay, so we're out of Hubbard, we're in the Southington here.
3359 Eastleigh, Fusselman Road, Joyce and Larry.
So, I'm sorry.
Are they available?
No, I think the only person online is
Okay, I wanna give them an
one of the
opportunity.
secretaries.
This is the road you live on, isn't it, Mr. Barry?
I live pretty close.
So anyway, so present solid waste, rodent and insect infestation, not good, gross unsanitary conditions. I'd ask the board to adopt the motion as presented.
So motion.
Seven.
Okay. If no further questions, roll call please.
Mr. Adavazio.
Yes.
Mr. Barry,
Yes.
Dr. Furster.
Yes.
Mr. Dubus.
Yes.
Mrs. Salapata.
Yes.
Mr. Simon. Mr. Messersmith.
Yes. The next item is the approval of amended policy ADM 1040 travel policy.
I'll take that. So, as I think most, if not all board members are aware that, there are a number of requirements within grants and various programs that, not just myself, but several individuals in this health district are required to attend, specific trainings. Some recent ones were, or some are a result of grants. And, so since post-pandemic, they've resumed most of, if not all of the, in-person conferences. And so as we've been recently attending these conferences, it's noticeable that the amount of money that we reimburse individuals to attend these, not even close to covering the cost of meals anymore. So, I'm asking in section 3.0 of the travel policy under meals, that we adjust from $40 a day to $60 a day. So that the cost of the meals will actually be closer to being covered. So, and then you could see that was changed in 3.1. And then 3.2 just basically explains that, what, you know, that you can't carry over from one to the next, one day to the next, and then, 3.2.1 basically explains that if, let's say the conference offers lunch, but doesn't have dinner, then you take the breakdown of the 10, 20, 30 would be what they could spend at any one sitting for that. So we've always had that breakdown. I think it was 8, 12, and 20 before. So I think that was the bulk of the changes in this policy. It's, like I said, just because the cost has gone up so much that, it was really wasn't even coming close to covering what some of the employees were expending out for it, so.
Is there a motion?
Question.
Yeah, question.
On 8.2. Personal toll, phone call, laundry, entertainment, except for all that aren't, subject to reimbursement. But also in there, you have tips. Some places tips are automatically included in the bill.
It's something we're looking into to see if that can be, that's been a past language in ours. And so if we find out that it can, we can always amend this. But as of right now, we don't have confirmation that it can, so we left our current language in it.
Thank you.
Sure.
And Frank, these guidelines for lunch and dinner and breakfast, they can spend up to that allowance, is that what it is? I mean, if they spend less than that, they decide to have a chuck steak instead of a filet mignon, and it's less money. If it's only $20, they don't get reimbursed for the $30.
Correct.
Okay.
Now, this is an up to. And that's the max that we'll reimburse.
Any other questions or comments? The motion to adopt this policy is.
So moved.
Seconded by. No further comments or questions, roll call please.
Mr. Dubus?
Yes.
Mrs. Salapata?
Yes.
Mr. Barry?
Yes.
Dr. Firster?
Yes.
Mr. Adavazio?
Yes.
Mr. Simon? Mr. Messerschmidt?
Yes. The next item is the declaration of unfit rescindment of an unfit on 665 Braceville Robinson Road, Don Postaway and Douglas Postaway owners.
Okay, so this one was, one that the board had declared on February, earlier this year. They sold it, they made significant improvements. The township approached us to, see if we could rescind it. The inspector went out, looked at it, and we're fine. I'm okay, my inspector's okay, so if the board's okay, I ask them to rescind that motion.
Is there a motion to rescind this motion? 24/41. So motion. Second,
I'll second that.
any questions or comments? If not, roll call please.
Mr. Adavazio?
Yes.
Mr. Dubus?
Yes.
Mrs. Salapata?
Yes.
Mr. Barry?
Yes.
Dr. Firster?
Yes.
Mr. Simon?
Yes.
Mr. Messerschmidt?
Yes. The next item is a variance request from Michael Davis, 3759 Woodbine, Hubbard Township.
No, okay, so this is a variance request. So in the process of putting a new septic in, they were caught between meeting the isolation distance from the driveway to the property line, or the septic to the property line, or septic to the driveway, so they chose to be closer to the driveway. So what they're asking here is for the board to grant a variance so they can put their septic tank in 3 feet from the driveway. Normally it's 10 feet, so you'd be granted a variance from 3701-2906 G3A.
Did they fix the top of this tank that collapsed?
They're in the process of doing it, and this is because you can't be 10 feet from driveway and 10 feet from the property line. There's only 13, so they have to choose one or the other. So they will do that once this is granted.
Okay, fine. Is there a motion to that effect? So motion, variance. Seconded by
I'll second.
Simons. Is there any questions or comments? If not, roll call please.
Mr. Adavazio?
Yes.
Mr. Simon?
Yeah.
Mr. Dubus?
Yes.
Mrs. Salapata?
Yes.
Mr. Barry?
Yes.
Dr. Firster?
Yes.
Mr. Messerschmidt?
Yes. Are there any citizen comments?
I don't know yet.
If none,
I don't know.
there's a motion going to executive session for pending litigation. Is there a motion to that effect? Going to executive session? No motion. Seconded.
I'll second.
Roll call please.
Mr. Edavizio,
Yes.
Mrs. Salapada.
Yes.
Mr. Barry,
Yes.
Dr. Forster.
Yes.
Mr. Dubus,
Yes.
Mr. Simon.
Yes.
Mr. Messersmith.
Yes, who do we want in the executive section?
Legal counsel.
Legal counsel. Rest are excused.